And when the doctor looks at our joint and says, you've got arthritis and that's why you have pain, we don't question that. We should, because arthritis doesn't cause pain.
Welcome to Wellness, your ultimate guide to unlocking your full human potential through biohacking. I'm your host, Ashley Deely. I'm a certified sports nutrition coach, former personal trainer, and Pilates instructor, and I have a degree in kinesiology. My goal is to help you improve and elevate the quality of your life. When you leave a review, it makes a positive difference. Whether you're listening on Spotify, watching on YouTube, or listening on any other streaming app, it helps listeners just like you find this hidden health information faster. America hasn't updated its beauty laws in over 80 years, and the cosmetics industry is highly unregulated, meaning harmful chemicals are hiding in your typical drugstore and big box products. But Araza Beauty is the first paleo-certified makeup line in the US, made with real ingredients you can pronounce. Their formulas are nourishing and actually good for your skin. They promote that youthful glow and high performance results. Visit arazabeauty.com/Ashley Deely, ARAZA. That's arazabeauty.com/Ashley Deely, and you'll save on your first order. Today's guest is Dr. Hal Blatman, a second-time guest on the show. He's a board-certified practitioner of integrative and holistic medicine. He's also a myofascial release physician who focuses on regenerative medicine and holistic healing. He's also the founder and medical director of the Blatman Health and Wellness Center and has dedicated over 30 years to helping people overcome chronic pain and restore their health through innovative, non-invasive treatments. He was frustrated by the limitations of traditional pain management, and he pursued advanced training in regenerative medicine, stem cell therapy, and nutritional healing. He now helps treat conditions such as MS, ALS, lupus, dementia, and other degenerative diseases. He's a pioneer in using not only stem cells to restore joints, heal tendons, and ligaments, but cutting-edge technologies to promote anti-aging, longevity, and health optimization. Dr. Blatman's practice combines the best of conventional and alternative medicine, offering a path to true healing beyond prescriptions and surgeries. He's helped thousands reclaim their health and quality of life, and I'm deeply grateful that he's decided to join us for a second time. Dr. Blatman, welcome to the show.
Thank you.
I'm so excited to have you here for the second time. Last time we ended our conversation with thermography and sleep. And I know about thermography for breast imaging, but for people who don't know about it, especially for pain management, how do you use thermography?
Another piece of information when I'm trying to figure something out and I'm having trouble doing it. Thermography is a way to use a camera and take a picture of something and know what its temperature is. So in humans, we take a picture of the human and see what your temperature is. And so we can see the temperature on your skin, and we can see 0.05 of a degree centigrade at 400 or more lines of resolution. So really small differences, and we can see the patterns. And you might not know this, but as you go from your waist to your toes, your body cools. Your feet are cooler than your waist. And as you go down your arms, you cool. And there's a pattern of that that's considered normal, and then there's variations that are considered abnormal. And to see where things light up and where things are quiet and where things, sometimes that is the best information you have. In Cincinnati, we have an infrared imaging laboratory big enough to swing a golf club, a tennis racket, and a baseball bat. So you can take 20 or 30 swings and we can image your shoulder and see where it heats up. That's another level of information beyond a CT scan and an MRI scan and an X-ray and, of course, physical exam, which tells so much more, and so many of us are really not taught how to do that.
So how does thermography help you when it comes to pain management?
One of the ways to know whether you really have a disc causing part of your lower back pain is to image your back and see what that image looks like, because a lot of people who do have a disc, there'll be a thin line going out to the side at the level where that disc is. Otherwise, how do you know that the disc on your MRI is really causing your problem? And the answer is most likely you don't. You're taking that on faith, and you have no idea. And most of the time, it's not the disc causing the pain, as we discussed last time and can certainly discuss again. If you want to see whether your thyroid is abnormal, does the nodule light up and get hot, or is the nodule cold? You have a lot more to worry about if there's a blood supply and it's warm than if it's cold. You can look at skin and see whether part of skin is warmer, either because there's something wrong with the underneath the skin, or if there's some process going on in the skin itself. You can look at a diabetic foot and see if it has enough blood supply to sustain what level of amputation. You need to be able to cut back far enough that there's enough blood to heal the wound. Well, how do you make that decision? One of the decisions can be, what's the thermography scan look like? Where does the warmth go away? Where does that foot get cold? So it has lots of uses beyond screening for breast issues. You can, might as well mention this too, you can look at the scrotum of a bull and tell whether he's going to be worth his weight, so to speak. Same thing with a racehorse. You can tell whether the racehorse is sterile.
Wow, all with thermography.
Well, whether the testicles heat up or whether they're cold. When they're cold, they're not going to do a whole lot that, you're paying that due.
Could you also correlate that to fertility in humans?
You have a way to see ovaries, but certainly, yeah, for testicles in men, you absolutely can.
Wow. Okay.
Yeah, it's just another piece of information that hopefully is helpful.
Yes, definitely.
There's a lot to use thermography for, and then there's a lot more you can read and just go online and what is whole body thermography and what can it tell me?
What is whole body thermography and what can it tell us?
Picture of the whole body, and you see nuances all over. Does the lymph drain here? Do you have more heat over your liver? Do you have heat over parts of your lung? Is your abdomen a uniform temperature? Probably not. And does it give you a clue as to what's going on inside of you that you're curious about?
Okay. I really appreciate you diving into that because I know we had just a teaser and tip of the iceberg last time.
Okay.
Also, since we last spoke, you have opened a new facility in Cincinnati. Can you tell us about that?
Cincinnati is a really awesome facility. We have an amazing staff. We're growing in our size and growing in our capacity. And so we have 3 places where we focus. One is we understand pain. We understand injury. We know where it comes from. We know how to find it. Most of the time we know how to help it heal and for pain to go away. And unfortunately, for most of us still in pain, pain is not what your doctor was taught. And most of what we were taught about pain is not the way our body works. And so why would we expect that the treatment we're taught to do for it should work any better? And it doesn't. And that's why people still hurt. And tied with that is the higher end of sports medicine and sports care, because even what you think your orthopedic and hand surgeon know, there's a lot that they have missed along the way that's causing your pain as an athlete. And just, for example, joints don't cause pain. And we all know that arthritis does not cause pain. And none of us, or very few of us, actually connect the dots. Do you remember how you know that arthritis doesn't cause pain and the pain doesn't come from the joint? We all know people that have had their knee replaced. And some of those people, the knee still hurts. And if pain really came from the joint, that wouldn't be possible. So we, as a group of people who are reasonably observant, every day we're reminded that joints don't cause pain. And when the doctor looks at our joint and says, you've got arthritis and that's why you have pain, we don't question that. We should, because arthritis doesn't cause pain. It doesn't come from the cartilage. The pain you feel in your knee is not coming from your joint, except once in a while. It's not coming from your meniscus. And what your cartilage injury does is it restricts motion, but it doesn't cause you pain. So pain's not what we were taught. That's our first focus, and that goes with high-end sports. And I've had some really interesting experiences just in the last year. And this year, again, I was part of the performance and recovery team at the U.S. Open Senior Golf Championship, working on the players and the caddies. So we do have some insight into sports. And while we're talking about the sports everybody recognizes, what about the instrumentalist? The guy who's playing the guitar and the keyboard and the violin and the viola and the drums and whatever. There are several people that we've helped save careers who play professional, who are professional musicians, from the orchestra to rock and roll. And because that's an incredibly athletic job. And not only does your voice have to go, but not only does your brain have to coordinate all your moving parts, but your parts have to work and not be in pain. It's a tremendous athletic thing to be able to play a guitar, and to be able to play a viola, and to be able to play the drums. Your arms and your legs do a lot of repetitive work. And then the violin, your neck has to hold your violin. That's not so easy for an hour and a half, or 2 hours, or 3 hours. Lots of strain and stress. So our first is pain. Our second is doing a lot with neurocognition. We're doing a lot with recovery of dementia, Alzheimer's, MS, ALS. It's amazing what we're not taught anything about how to put these back together. And there's so much information now to help people recover their brains. And the third is cancer. We've been helping a lot of people with cancer issues, because a lot of the two most important things when you have a cancer process that you need to get right, one is you got to get your food right, and the other is you have to get your head right. And regardless of what you do with chemotherapy and radiation and this and that and everything else that standard of care wants to do, and this doesn't interfere with that at all, is you still need to get your food right and you need to get your head right. And you need to understand that the candy in your oncologist's office is not your friend, and it really shouldn't be there. So how do you do that? Well, we certainly help with that. And we also point you to some resources that you really want to take a look at. One is believebig.org. That's the public organization to teach you about mistletoe. Who can help you with mistletoe? What is mistletoe therapy about? Where does it come from? What does it do? And it turns out that if you can get mistletoe therapy to go along with your cancer therapies, it makes your other therapies less dangerous to you and more dangerous to your tumor, and bigger chance that you'll be able to survive with less side effects the other therapies that standard of care is used to doing. So you really do want to learn about mistletoe. And for the basics in food and nutrition, we send people to a resource, Nasha Winters, Nasha Winters, and the metabolic approach to cancer. But whatever you choose to do in whatever circles you go around, you got to get the food right and you got to get your head right. So those are our three pillars, and we're working on teaching the public. We're working on teaching other professionals. We have conferences in our space, and we have a infrared sauna and a cold plunge. So we're really working to help people heal in so many ways. We have people that are doing thought field therapy and some other things that help you get rid of, whatever process is going on in your brain. Psychotherapy is a lot of fun, and it can work. But a lot of times you go and you spend an hour and you talk to this person and you tell them about your problems, and maybe you understand them better when you walk out the door, but when you walk out the door you still have them. And have you really moved your needle, or are you stuck? And I get tired of that. I want to be able to go into a session with my problem, and when I walk out the door I want my problem to be different. I want the work to be done. I don't want to still have it to do. And so we have people in our office who are really good at helping you do that, because you don't really need to do the same thing over and over and just pull your hair out. You really want to move things along. And while we're at that, and we're really trying to help people help themselves, there is a way you can do your own kind of psychotherapy at home. There's an app called Liberate, Liber, and then the numeral 8. How do I draw an 8 on the camera? Yeah, there's an 8. Did you see that?
Yeah.
If I could do the news, there'd be a map behind me, right? And I could draw on that. So Liberate.com, it's a free app, and it teaches you how to recognize the things that trigger you and how to map those triggers. And then when you pay for something, you pay for a professional who understands that to take you through something they call a mapping session. And you learn how to map your triggers and you learn how to deal with them. And that's really designed for the person who really wants to keep most of their psych work private, doesn't really want to have a therapist to go to, like to do it in the comfort of your house, doesn't want to spend a whole lot of money, wants to do it all by yourself, but you need some guidance. And maybe you've been through therapy lots of times, and every time you go, you end up stuck in the same place, doing the same dance. This is built for you to get through that with the least bit of hassle and cost.
Whew.
Yeah.
All right.
For the do-it-yourselfer who doesn't want to go to the therapist but needs therapy.
I really appreciate these insights and this, I appreciate what you're giving us. The websites to go to, the different books. I love Dr. Winter's recommendations.
Mm-hmm.
One of the things that we spoke about last time was sleep, kind of just tip of the iceberg. And you spoke about different musicians' pains or athletes. I'm wondering, what kind of options do we have if we wake up with pain? For instance, we feel good, but then maybe we wake up with stiff feet or a stiff lower back.
You want to realize, well, here's an interesting question. If you sit for a while and you're relatively comfortable, even people in pain, if you sit for a while, your body kind of figures itself out and some of that pain at least goes away. When you get up and move, do you feel it glued together on the inside? Do you just get up and move like you don't have an issue? Or you get up and move and you're stiff and you gotta grease all the hinges and then you get to move, and is that you? And if that's what you're talking about and that you experience that, then your food isn't right. And you actually do glue together on the inside if you sit still long enough for that to happen. And It doesn't take much of not right to make that happen. All you need to do is have a tiniest morsel of cross-contamination sometime in the last 6 weeks. Sometime in the last 6 weeks. And people will tell you, don't eat so much of this, eat a little bit less candy, don't eat so much of the white stuff. But when somebody tells you you have a crumb of bread that is not gluten-free, you are turning on pain symptoms that could last you a month. And if you have dementia, or you have a neurologic issue, especially neurocognition, you feed the fire in your brain with the tiniest amount of gluten, and you cannot do that to your body and recover. Just as critical as it is with cancer, the food is very important for healing most any chronic illness, and that's where that fire comes from. Sleep is a different issue because we need sleep to be able to restore our brain. We need sleep to be able to rest our bodies. There's all kinds of reasons that we need sleep, and there's all kinds of things that prevent us from sleeping well. Sometimes it's medicine, sometimes it's your brain and your worries and your list of whatever, sometimes it's your anxiety and your stress, and sometimes it's your apnea, and you don't breathe well, and you stop breathing. And here you are peacefully minding your own business, trying to sleep, and your brain wakes you up because it wants some oxygen, and you forgot to breathe. And so it makes you breathe. And well, the only reason your brain's making you breathe is because it panicked. And when your brain panics, your heart rate goes up, your stress levels go up. That wakes you up also. But as long as that happens, your insurance company knows that your life expectancy goes down because of the stress of waking up several times a night in a panic because your brain thinks that you don't have enough air, and primarily it's right, because when you put the things on that make that go away, you can work those symptoms out. But you didn't have that necessarily when you were younger. Why is it happening now? And part of that is the shape of your mouth, and part of that is how much do you weigh, and how much does that weight interrupt the space that otherwise would be in your mouth for air and your tongue and your teeth to peacefully coexist. So helping you sleep is tremendously important. If you really need to sleep and you can't find any other way to do it, then there's medication that can at least help make that a little bit better. And some of the medications we use for sleep are harmful, and they actually may accelerate a dementia or make one happen that wouldn't have happened otherwise. Nobody really knows the answer to that, but there is a risk to that. And there's others that are really, really helpful and make it so that when you wake up to go to the restroom, if that's what's keeping you up, you're able to go back to sleep afterwards instead of lying there and counting cows. And if the restroom does wake you up, or the need for the restroom wakes you up on a regular basis, you need to fix that. Maybe you shouldn't be drinking water after 6 p.m. or 5 p.m. Or maybe you need your prostate checked, or maybe something else has to happen because your sleep is being interrupted. But sleep is a really important part of recovery, and you're supposed to do it every day, whether you think you need it or not. And then there's melatonin. And everybody thinks melatonin's a sleeping pill, but it's not. Melatonin's an antioxidant for your brain. And it does help regulate your day and night cycle. But if you have a place where your brain is going to take a hit from oxidative stress, you're good to do melatonin 2 or 3 times a day. It's not just for nighttime. And if you're going for a CT scan that's going to put radiation in your brain and your body, melatonin before you go is a great idea. So melatonin has way more uses than sleep. Another thing people can use are herbal medicines, especially if you are the person that can't rest your brain at night and it's still going 90 miles an hour and you need to calm it down. The herbal medicines for sleep are not sleeping pills. People take valerian root at 11 o'clock and expect it to put them down. It's not going to do that. You need to be put down. You got to go to the pharmacy for that. And the doctor, because he has to write the prescription the pharmacy is going to fill. But otherwise, what these herbs do is that when your eyeballs see a tiger and you want to run, they pat your adrenal glands on the head and tell them it's only half a tiger. You don't have to run. Sit down and have a cup of tea. And then as long as you walk faster than George, the tiger isn't going to get you. So it really calms you down. But if you're doing that, you want to take those at 5 p.m. so that the phone call that happens at 8 o'clock doesn't get you keyed up. And then you want to take them again at 10 or 11 p.m. so that whatever dream keys you up at 3 a.m. isn't going to win. And so you tend to have a better time sleeping through the night. But that's what those herbs are really good for. And there are several that you can count from. And they just calm your adrenal systems. One more thing about sleep, the dentist. Yeah. You can't talk about sleep and miss talking about the dentist. And it's good that we didn't mention it before because it really deserves its own special place. The dentist can move your teeth to make more room for your tongue. The dentist can change the position of your jaw so it doesn't fall backwards when you sleep, so that your airway stays open. Those things can make you better enough to avoid CPAP. Those things can also improve your condition so that if you needed high pressure on your CPAP, you might not need that anymore, and lower pressure will work. So if you have sleep issues, you really do owe it to yourself to see a dentist who specializes in sleep issues. And if you're lucky, that will also be an orthodontist who can do what you need to do for that effect. Also, it's not just the surgeon who's going to move your palate. It's really moving the teeth. And if you're a child, you want your parents to be aware. So this is more for the parent. You see people with wide faces, and you see people with really narrow faces. The more narrow your face is, the less room you have in your mouth for your tongue. It's not such a good idea. You want more room. But what makes that face narrow is two things. One is a diet that's high in carbohydrates as a child. So what you eat determines somewhat the shape of your face. And you can look at that. You can see Weston Price went to Africa and took lots of pictures. And before the American diet got to Africa, faces were round and there was more room in the mouth. And afterwards, the faces are narrow and they have the same issues as the people who eat that food here. So that's one. And the other is your tongue tie. The shape of your mouth and the size of your mouth cavity is greatly determined by what your tongue can do. And if your tongue is tied to the floor of your mouth, it is not going to reach up and shape your palate. It's not going to push your teeth further apart. And so when you have a 8-year-old tongue-tied person with a thin face compromising their airway, they need the orthodontist now to put a palate expander and change the shape of their face. And you'll find out that their teeth aren't crowded. The need for braces goes away. Remember, pay me now or pay me later. Pay me at 7, and you won't need braces at 15. And then you also won't need the apnea care when you're 50. So parents, get your kids into the pediatric orthodontist early and avoid all these problems. And when you have a tongue-tied infant who's having trouble breastfeeding, it's not the boob that's the problem. It's the tongue in the infant, because the baby doesn't suck. The baby's tongue massages and that releases the milk. And if the tongue is tied and can't do that, the baby can't eat. They can do a bottle because bottles are sucking, but they can't do mom. And then their face isn't going to be the shape it needs to be. All because somebody told you that tongue tie wasn't important and you didn't need to pay attention.
Wow. Oh my gosh. Well, I feel like that could be an entire episode, and I've had a couple biological dentists on, so I'm really glad that you brought that up.
You should also get somebody who understands the tongue tie.
Yes.
And breastfeeding and all the pieces that go with how do you release it, and then what is the aftercare mom has to do to make sure the child doesn't glue right back together again.
Yes, such a great idea. Really appreciate that. All right, can we now switch gears and talk about brain health?
Sure. The first thing is, what's causing the problem? And for people who have dementia, everybody says, well, you've got ApoE and it's your genetic structure, but it's not. It's your food. And your food is feeding a fire in your brain that you need to put out. And if you don't get the food right, you can't put out the fire. And if you do get the food right, and you do get better, and your relatives convince you that it's okay to go back and eat birthday cake because Susie is 2 years old, you get your dementia back. You can't ever go back and eat that food. So people come to our country, that's the USA, in case this is out there further, from all over the world to get sick because you eat our food, and our food isn't good for you either. You can find food that's healthy, but as it turns out, if you want to retain your health, the most important money you ever spend is on your food. And if you want to know where to spend the most of it, you can go to website ewg.org, Environmental Working Group, if you know about them. And you can read about the Clean 15 and the Dirty Dozen. And the Dirty Dozen means don't ever eat them unless they're organic. And the Clean 15 means organic's not important, don't waste your money here. And you can actually go through their website to a .gov website and look up every zip code you ever lived in and see what was known to be in your groundwater back then that poisoned your body. Of course, there's lots of things they didn't know, but there are things they measured, and those records are kept, and you have access to them. So what feeds and makes the fire in your brain? I'm going to tell you number one is gluten. So let's deal with that and how we can so certainly say nobody in our species can eat it. Even though there's lots of people who think they can, and lots of people don't think they have a problem, nobody in our species can really eat it. Because one of the things that happens when you eat gluten is you increase the number of zonulin proteins. Sounds like it's 3 parsecs that way in the country, not country, the planet Zonula, or the starship, the star system Zonula. But if that helps you remember zonulin proteins, go look it up. When you have something floating down your intestinal tube, and your biology needs a piece of it, and you got no way to bring it inside, the lining of your gut secretes a zonulin protein. The Holy gap opens, or the gap opens in the Holy membrane. Whatever it is comes across, and then the gap closes. And when you eat wheat, or gluten, you get an extraordinary number of zonulin proteins, violating the integrity of your gut barrier, your lung barrier, and your blood-brain barrier, and you have no way to stop that. In your colon, meanwhile, is something called lipopolysaccharides. They gave it the name LPS because everything has to have 3 initials these days, except for erectile dysfunction, that only has 2. Thank you, Bob Dole. So these are lipopolysaccharides, and these are dead parts of cell membranes of bacteria that your immune system has killed. And it killed them because it recognized the label, we call it markers, on the outside of the membrane to say, hey, I'm a bad guy, kill me. And the only reason you know that is because your immune system encountered these guys before and remembers that these are bad guys by their identification marks. Well, even when these guys are dead, their dead parts still have the markers. And those markers still set off your immune system. And your body is trying to push them out of your south end. And you just ate gluten, and you opened up the doorway, and these things leak across. And the immune system in the wall of your colon has to deal with that. And it does a fairly good job until it starts to misbehave. And when it misbehaves and malfunctions, and that's the source of that misbehave and malfunction, that's where lupus and rheumatoid arthritis really come from. You keep your gut clean, you don't get them. And if you have a positive ANA on your blood test and you know what that means, that's a warning shot across your bow that you're headed there, and you still have time to fix your food and convert your positive ANA to negative. But let's go back to these lipopolysaccharides that are leaking through your holy wall in your gut tube, and those that get through and past your immune system easily get to your circulation and easily cross your blood-brain barrier. And when they cross your blood-brain barrier, the glial cells, the immune system in your brain, also is tuned to recognize these as bad guys, and that feeds the fire in your brain that kills your brain cells because you ate gluten, and you don't have any way to stop that. And as long as you feed that fire, you are not going to be able to put it out as well as you need to put it out to recover your brain. So, gluten-free, dairy-free. One of the most inflammatory things you can put into your body is dairy from cow. Humans are the only animals that drink milk from not their own species, and especially after infancy, and think it's a good idea. There's nothing in milk that you need that comes from a cow. Everybody says you need it for calcium. But the NHANES, N-H-A-N-E-S, study of more than 3,000 nurses in the Boston area was where it started, showed that those who drink milk have more osteopenia and more osteoporosis than those who don't. So the only things that make milk good for you are the stuff that gets added, and there's nothing in it that you need. So for a child, soy milk is a no-no. The closest thing to mother's milk is actually camel's milk. I know, 1 hump or 2, right? Camel's milk is closest to mom, and otherwise it's goat and sheep. And you might need to add some folic acid to it from your compounding pharmacy to match mom, but the fat globules match mom much better than cow. The gut microbiome matches mom much better than cow. The immune system IgA that you get from milk as an infant matches goat and sheep way better than it does cow. So, we ran out of formula, and I'm like, thank God, nobody needs it. You shouldn't be using formula anyway. But lo and behold, we've got formula back. Yay.
I just wanted to take a moment to go back to what you said about lupus, because I have a friend with lupus, and she said she's really thankful for her doctor. She's feeling better. But the way I interpret it is that she wants to be on medication for the rest of her life. But it sounds like
And
lupus...
she got put on a biologic because those are the drugs that work for this. But they have a black box warning that when you compromise your immune system so it can't recognize the things that it should be recognizing, it also won't see your cancer till it's way too late. And we grow cancer all the time, and our immune system shuts it down all the time till it doesn't. So be real proud of your biologic drug, and be real glad that you can move again. And be real glad that somebody can give you a drug so you don't have to listen to any of the things I'm saying about changing your food and then find out what happens to your body between age 30 and age 50 if you start it too young. And all you need to do is gluten-free, dairy-free, sugar-free, no carbs. If you have rheumatoid arthritis and lupus and you have a teaspoon of sugar, your immune system is in a tailspin for a month. You get away with nothing. And you go, oh my God, I can't do that. Actually, you can do that. And it's really the only thing you can do to achieve the health that you need. And everything else you do to avoid doing that is putting you artificially in a place that you really should not be. MS, ALS, all these things, you have to put out the fire in the brain or you can't recover. And then you can start to rebuild. And a lot of people think you can't. But we only had one dementia patient not getting better who did everything we taught him to do. If you don't do everything we teach you to do, I don't expect you to get better. If you're 250 pounds and you tell me you're carb free and you don't lose 30 pounds a month and you're still 250 pounds, somebody's lying and you're not getting better. And it's not my fault you're not getting better. Grandpa's cheating and he's eating stuff on the sly that he has no business eating and he doesn't know. And grandma doesn't care enough to change her food. She's not going to stop eating it, so she's not supportive. That family's in trouble. You go home and need to change your food and your family's not behind you, you're in real trouble. You're in a nursing home where they feed you on $5 a day and most of it's carbs, you're not going to survive. So the most important thing is to fix the food. And then do things that restore brain cells. There's a mushroom called lion's mane that helps you grow new brain cells. There's all kinds of supplements that you can take, but the supplements will not save you from the food. You still have to get that right or you're wasting your money. You'll slow it down, but you're not going to stop it. And we had one patient, I said, who was really continuing to deteriorate. And one of the things we can now look at is we can send your blood to a research laboratory at Johns Hopkins, and we can have the fatty acid analysis done of your cell membranes and know what you're made of on the inside. And you'll be amazed how many people do not have enough fat, raw materials, and resources to grow a brain. They've been so fat-free for so long, they're using the wrong kinds of oils in their cooking food, they're taking the wrong supplements through their day, and their fatty acid is so messed up, they can't grow a brain. And so we work with a lipid researcher to correct the fats in your body. Sometimes the fat you need is an egg yolk, and you'll eat soft egg yolks, 9 of them a day, if that's what you need. It's stuff you don't even think of necessarily, but otherwise you're taking a guess. The doctor says, eat fish oil. Which fish oil are you going to take? If your fish oil smells bad, it's rancid. Don't eat it. If your fish oil isn't filtered, it's probably not going to help you. It's got mercury and arsenic in it. If your fish oil isn't prepared in a nitrogen environment and there's oxygen nearby, then it's oxidized. You don't want that fish oil. We actually have our patients eating caviar, unprocessed raw fish oil. You can't get better than that. It doesn't need to come in a pill. You need to know where to order caviar. So we do that. What omega-6s do you need? What omega-3s do you need? And yeah, there's all kinds of tests out there to look at that, but most of those tests take a half hour or they're a blood spot on, and they take 5 minutes. The test that we do takes 9 hours and gives you the answers you need down to the letter. That's fascinating. And that's helping these people turn the corner that otherwise didn't. And then there's peptides that you can get that help your brain grow new brain cells. That's also fascinating, but there's so much to do. You know, the average person comes to us and says, we went to the neurologist. They gave us very little that could help. Do you have anything to suggest? And they walk out with a list. Another thing that we want to mention on all these neurocog issues is you got to find the poisons in the body that kill the brain, not just the inflammation. You got to take the poison out. Lead, mercury, arsenic, cadmium, Roundup, all those things are bad for brain. Microplastics, do you have a filter that takes them out? And how do you get that out of your body? There is so much to do that needs to be done. It's not just one thing. There's no magic pill. It's a group of things all stacked together that are all important. But if you don't get the food right, it's all for naught.
You're so full of wisdom, and it's just genuinely refreshing to speak to you because so many physicians are not taught the way that you were taught. I know you were very curious and distraught.
Taught. I had to go search this out and learn it. We're not taught this. We're taught how to be a pharmaceutical puppet. We're taught that really well. We know what drug for what condition, if there is one, and we know how to prescribe it, by golly. So, you know, you're a shining point in light helping people navigate this very, very complex arena. Who do you listen to? Who do you choose to listen to? That's difficult to figure out. because there's so many voices. But to separate the wheat from the chaff and to say, no, I don't want that. This is what I need to do. This is the wisdom I want to follow. There's a lot of influencers, and not all of them steer you in the direction that I would steer you.
Well, that's the trouble, I feel like, where we are in 2025. People want to listen to influencers instead of doctors because you can just open an app and it's free.
Yeah, but there's also, to be fair, there's influencers that know what they're doing, and there's doctors who don't. It goes both ways. When the doctors in California went on strike, the death rate went down.
Wow.
The fourth leading cause, depending who you ask, of death in this country is prescription medication from well-meaning physicians. This is big. So fortunately, we have an internet, and you have access to information you never had access to before, unless you had an Encyclopedia Britannica and it was already outdated. So I would rather have the information and have to sort through it than not have the information available at all. I'd much rather have a patient come into me with all these websites that disagree with the things I've taught them to do and bring it in, print it out, and let's go through them one by one. I'd rather let you have access to be able to do the research, to ask the questions, than to not have it available at all and listen to me as your only sole guidance. If you're not your own advocate and you're not doing your own research and you're depending on your doctor to know it all and do it all, you need to do better than that.
I like that advice. Well, Dr. Blatman, as we wrap up this podcast, which I know is a short one today, I ask all my guests the same closing question, which is, what haven't I asked you that you'd like my listeners to know?
Oh dear, I don't have anything pressing because you've really let me get a lot off my chest and a lot off my mind, and I have been pretty frank with everything that we've said. So I don't have another piece I need to tell you, but I'm sure there's a lot more in there to drag out if you want to come back and play again.
Yes, that's right. Well, we can schedule a third interview. We'll make this one a deep dive, really get into the nitty-gritty, and come back with some very specific questions about ALS, MS, and what you do for brain health. That's something that I'm really interested in. But for now, we will wrap it up, and thank you so much for your time today.
Thank you. It's been such a pleasure to speak with you again. I'm really honored to be any place in your heart and on your show. And I think your mission is one I align with in a very big way, and I wish you all the best too.
Thank you so much, Dr. Blatman. Thank you so much for listening today. A quick shout out on Instagram or sharing this podcast with a friend can make a positive difference. If you're listening on Spotify, Apple Podcasts, or watching on YouTube, a great way to support the show is by leaving me a review. You can also support my work by using any of the affiliate links in my show notes or by visiting my website, ashleydaily.com. This podcast is presented for educational and exploratory purposes only. The published content is not intended to be used for diagnosing or treating any illnesses, diseases, or disorders. Those responsible for this show disclaim any responsibility for any possible adverse effects from the use of this information presented by myself or my guests. Please consult with your healthcare provider before using any products or services referenced in this podcast. The content here is for informational purposes only. Episodes on the Welcome to Wellness podcast may at times cover sensitive topics, including but not limited to depression, suicide, 5G, nootropics, circumcision, birth control, the Women's Health Initiative, the use of plants medicine, abortion, geoengineering, terrorism, gender, AI, sex, drugs, and rock and roll. You are advised to refrain from listening to this podcast if you are likely to be offended or adversely impacted by any of these topics. However, if these topics interest you, you just may have found your tribe. The information or opinions expressed on the Welcome to Wellness show are solely the views of the individuals involved and by no means represent absolute facts. Opinions expressed by the host and the guests can change at any time. The views of my guests are solely their views, and the Welcome to Wellness show does not accept responsibility for them. Any action you take based on the information contained within this show is strictly at your own risk. The Welcome to Wellness host, Ashley Daly, will not be liable for any losses or damages in connection with the use of this podcast. You should take all necessary steps to ascertain the information you receive in this podcast is correct and has been verified. None of the guests or contributors on the Welcome to Wellness podcast will be responsible for your use of the information contained therein. Under no circumstances will the Welcome to Wellness show or my affiliates, partners, suppliers, licenses, or guests appearing on the show be liable for any direct or indirect consequences or damages arising from your ability or inability to access this podcast. All intellectual property rights belong to me, Ashley Deely, and include, but are not limited to, the copyright and any other rights in the design. You are permitted to use the Welcome to Wellness podcast for personal use, but not commercial use without a license. You may not make recordings. If you breach these terms, you lose the right to access the Welcome to Wellness podcast, and you must destroy or return any copies of the recordings you've made. Guests on the Welcome to Wellness podcast may at times provide information on or read extracts from third-party copyrighted work. The Welcome to Wellness podcast does not provide any medical or professional advice within these episodes. If you take any action or inaction as a result of the content you consume from the Welcome to Wellness podcast, this is based solely on your decision, and the Welcome to Wellness podcast, Ashley Deely, and my guests cannot be held responsible or liable for any of the consequences of such action or inaction. Thank you for listening.